All right, so we're going to go ahead and get started, everyone. My name is Rhianna Wilson. I am the here and also on the board of directors, and I am moderating today's session. Please feel free to use this space as you need or prefer. If you would need to leave the room, please let me know, and I can help with that. So excited to be here and introduce Courtney and Rhianna Musser for supporting children with disabilities in medical settings.
Thank you all. Can everyone hear me okay?
Yes.
Perfect. Thank you. So good morning. Thank you all for coming. I'm so grateful to be here. We are thrilled to discuss an important and often overlooked topic in international careers. As Rhianna and I have become closer friends, we recognize that both of us not only have diagnosis in common, but share extreme medical trauma experiences. In fact, we both share those experiences, and it's really impacted our trust in medicine overall. Fast forwarding many years later, let's say for me, not much focus, as we advance in our careers as both a pediatrician and social worker, we had the privilege to witness intervention teams and really face experiences for our patients. We educated ourselves on these practices and feel compelled to share them with you today. Our goal is to serve and empower families and individuals affected by ASD, and we hope this talk will leave each of you feel a little better equipped to navigate the emotional challenges associated with medical trauma. Before we get started, we just have some disclaimers. Throughout this talk, we're going to reference the field of child-based services to pioneer to optimize pediatric care. While we are not child-life specialists, several child-life specialists were instrumental in the construction of this topic.
Okay, can you guys hear me? That's the first question. Sounds good. So I just want to point out that I recognize that some of this material might be hard to hear for some of you. So if at any point you feel like you need to step out, feel free to. We definitely want to set that stage for if you need to leave, because we're going to be talking about mental health and the child development, as well as the impact of trauma. So if that's difficult for you, just feel free to step out.
So I want to begin by going through a very extensive list of struggling with hospitalized and disabled children. As we progress through our talk, I want to challenge each of you to keep this list in mind. And just to point out a few, we have unfamiliar events, unknown adults, lots of uncertainties, hearing adults talking about them, and lack of privacy. Without proper coping and intervention, these types of stressors can lead to lasting trauma for children, making future medical procedures more difficult. Rhianna's role as a social worker helps to facilitate coping and trauma in her patients, and she would kindly like to expand on this topic.
So I thought before we dive into more so what child life is and different ways to cope in a medical system, we should look at the generalized trauma and kind of do a trauma 101 really quick. So the general definition of trauma is a set of psychological and physiological responses to pain, injury, serious illness, medical procedures, and frightening treatment. That is the particular definition of medical trauma. Medical trauma is very unique in the way of general trauma is more so an external trauma response. Medical trauma is internal, so it's ongoing. It's always there, as we know, for chronic. The pain and everything like that is constant. So stress responses. I'm going to do this fun little thing that I do with families at work. It's by Dr. Daniel Cagle. It's called the HAND model. So with our trauma response, when our body senses a danger or threat, it'll slip away. So the four fingers here are the prefrontal cortex. That's our logical reasoning of our brain. My little thumb here is our amygdala, which is our emotional response. So what will happen is when we sense danger, the prefrontal cortex will deactivate, causing us our legs to flinch. And our emotional response will happen, which will trigger the fight, flight, freeze, or fawn. So fight, flight, or freeze, you might have heard before. Fight is when we often either become aggressive, whether that's verbally or physically. We might fight, such as avoiding conversations on medical topics. avoiding appointments, such as delaying them, or grief, such as shut down altogether. The new one that has just come about is called awning, and this is kind of people pleasing. So saying yes to things, even if we might not necessarily want that, just because we want to keep the stress level as low as possible. And the goal to fight flight three is to decrease and/or engage danger. I'll give you a personal kind of experience of me doing a flight or freeze. So when I was around the age of 13, I had a surgery. I was going into my calf removal. During that, I was mid-calf removal, and I froze, and I passed out. Mid-calf removal. That was because my body was in danger, even though I had passed time and time again. Now, I wanted to turn that around, though, because something positive about that. My doctor took my time to stop what he was doing, moved me to another room. He got me a lollipop, which was a lollipop at that time. He also talked to me about sports and things I liked. But he also allowed me to be in control of the situation. So we sat for about 20 minutes talking about nothing related to the medical process until I was ready to go back and get back after. And because even though my body was responded in a dramatic way, that experience is positive to my brain because of how Dr. Z has responded to that response I had. So, I broke the medical trauma systems that is like long term or short term into 4 different categories so that you can process it a little better. So, avoidance would be such as avoiding your medical appointment, cutting them up. They say you have a medical appointment next week, but you really don't want to do it. You might keep putting that appointment off. You might avoid talking or thinking about ANC for a while. I can talk about or think about it. You might re-experience flashbacks or repeat the same medical conversation over and over again. You might also experience tics or tackles, which can include junkiness or having a hard time sleeping. It's also important to point out that trauma symptoms aren't just in your brain. There also can be physical trauma responses, such as elevated blood pressure, and it can experience social isolation, which is kind of how high personally have the most trauma responses. Was their anxiety, depression. I was very irritable, and I also had to self lot and a lot of shame around my diagnosis. So interventions in medical trauma can be a range of things, and we talked about it specifically throughout this presentation. The first one would be things such as this, coming to support groups to support one another and really bring light to the feelings that we have. Another one can be coping strategies. Everything is different for people, so for me, I hate journaling. That is not helpful for me, but for some people, journaling might be helpful. I personally rather do breathing activities. Trauma therapy can be beneficial. Not for everyone, you have to be open to that. But it can be beneficial if you're ready for trauma therapy. Trauma assessment in a medical setting is really helpful, as well as the number one thing, caregiver support. I often preach at work that a kid can go to therapy, they can do all that, but it's not without the caregiver support that they really can gain that resilience, because that'll help them succeed. So even by you caregivers being here today, that's helping your kids.
Thank you, Rhianna, so much for articulating the concept of trauma so eloquently and passionately and sharing some personal stories. The remainder of our talk will focus on ways to reduce this trauma that accompanies medical experience. We'll follow this outline shown here by introducing child life services. We'll focus on evidence-based interventions that can be applied to our ANCers. We'll discuss how to reduce anxiety and pain, how to support the family units. We'll talk about techniques specific to children with disabilities and chronic illness. And we'll end the talk with an example of an ANC patient. Throughout our talk, you can reference this QR code, which is here on the chair, as well as up on the screen, if you want to take a minute. It's kind of just a summary of our talk with some cool recommendations.
So I'm going to begin by kind of going in depth as to what child life specialist is. If this wants to. There we go, we found the slide. Okay, so in 1920s, they really began to realize that hospitalization did have an impact on children. So people get together and they're like, okay, how can we kind of focus on this in a hospital setting, and how can we limit the amount of trauma that the child might be feeling while they're here, and help them together. So they came together and they formed what we know now as the child life. So child life specialists, they specifically help the children as well as the families to cope with the stress and uncertainty of illness, injury, trauma, disabilities, loss, and bereavement through an evidence-based intervention. Some of the things that we're going to be kind of focusing on today include therapeutic play, procedure preparation, alternative focus, as well as education about illness, anxiety, as well as fear.
So child life specialists are an integral part of the care team, and we are so appreciative of those who have taken the time to teach us. I firmly believe that this education allows both Rhianna and I to provide holistic, patient-centered care, and the principles we'll discuss today are the foundation of child life services. I want to start by addressing an emotion that I argue is universal to any hospitalized patient, which is anxiety. This section of the talk will be broken up into preparation, medical play, and coping. Let's begin by talking about preparation techniques. Preparation increases a sense of predictability and control over potentially overwhelming life experiences in order to proceed with the lowest level of distress. This can be applied to procedures or medical rounds. Some of the main goals can include identifying strategies to decrease anxiety and finding meaning in difficult experiences. Preparing your child for a successful procedure should start by reflecting on the past experiences. Consider what has helped in the past, what was most scary, what went well and what didn't. As the caregiver, what types of comforts does your child typically prefer?
I don't think that.
Yeah.
Looks like one of them.
I go too far. Sorry, 1 second.
Got it.
There we go. Was clicking on 2 different screens. Sorry about that. So it's very helpful to explore your child's natural tendencies. Children often fall into 1 of 2 categories, which Rhianna touched on briefly. So this is avoidant or sensitizing. Children who are more naturally avoidant tend to want to delay or ignore the event, while children who are more sensitizing ask lots of questions and might express anxiety more immediately. Identifying their natural preferences can really help you to determine the quantity and information to help rehearse for the procedure. For example, a child with sensitizing tendencies should have lots of information compared to a child who seems a little more naturally avoidant. However, patients who have avoidant tendencies should still have enough rehearsal in order to know what to expect. As a general rule, younger children should have preparation a little bit closer to the event, while older would die. Avoid harsh phrases such as shoot and x-ray, and it's also important to be aware of unfamiliar terms that the child is likely already hear, such as scoliosis. A few more examples of developmentally appropriate language are listed here. Recognize that the suggested sounding words are softer sounding while continuing to accurately describe the term. For example, brown soap for betadine. We want to remain truthful. Kids are so much more perceptive than we realize, and therefore lying to them can lead to loss of trust. It's also important to avoid using the word bad. It can be helpful to instead say, has it been harder than you expected, rather than, was that bad? Children are such concrete thinkers, and therefore they may assume that they are bad, or that the medical team was bad. Once appropriate language is established, you can choose a preparation technique that is best for the child's age. Preparation for younger children is often achieved through the senses. Like I said, younger children are very concrete thinkers, so trying to explain processes through abstract thought is just really ineffective. Instead, you want to focus on what they might see, smell, hear, feel, and taste. And you can compare that to things they've already experienced in life. For example, you can say, you might be hungry because your stomach has to be empty for surgery. You may have a sore throat when you wake up. You will wake up with stitches or a cast that the doctors and nurses have to check. For older children, preparation through exposure is especially beneficial. Kids learn best through repetition and exploration. Whenever possible, use real gowns, gloves, or show them a tour of the OR or the hospital. For very young children, you can familiarize them with equipment through medical play. For example, my beautiful niece here is playing peekaboo with a contact gown. Allowing them to use and feel real items in a fun and non-threatening manner can really decrease anxiety. When exposure is not feasible, preparation albums provided by Child Life or applications like Simply Saying can be especially helpful. The Simply Saying app includes a glossary of terms, developmentally appropriate definitions, pictures, and even sounds. Here you'll see a screenshot of an MRI machine with sound display. There's also a screenshot on how to prepare your child for an echocardiogram. Your handout also includes a QR code to help you download this application here. It is equally important to prepare yourself as caregivers for procedures and treatments, as parental anxiety has been shown to affect child anxiety. We recommend that you discuss your concerns with a child life specialist and consider for yourself what went well in the past, what did not go well, how do you typically comfort your child, and I want to stress that you should always be advocating for the comfort role and not the role of holding your child down.
So we just went over a whole bunch of information on how to prepare your kids through for assessment, properly language, and social. So I'm going to move in now and try to discuss first on how medical play can help reduce anxiety. Okay, so medical play can be useful in a variety of different settings and applications, such as during the preparation of an appointment, the debriefing of an appointment, as well as helping the kids understand the diagnosis and different ways to cope with that diagnosis or the procedure. So, give me a second.
Sure, no problem. So an example of medical play can include these cloth dolls that have a blank face, where the child is able to act out and draw an expression on how they feel. This is really helpful in the future because, for example, if they drew a sad face, they can just show the medical staff that they're feeling sad or scared. Another example that I love are water baby dolls. The child life specialists are specifically trained to use real IV equipment and help the child actually insert an IV into the doll just to familiarize them with all the equipment and what's going to happen. And it's really, really beneficial. The top picture shows those dolls I was talking about, and the bottom picture is another example of medical play where the kids use actual real syringes to paint different pictures, which is really cool. I'm sorry. Okay, so often different materials are used to explain diagnoses to children. For example, candies to represent cells for kids with leukemia. But for kids with AMD, you could consider using toy like AFOs, toy cats. I actually, on TikTok of all places, discovered this company called the Butterfly Pig that makes little doll accessories. They make G-tubes, AFOs, central lines, IV poles, all kinds of really cool equipment that you can get for your kids just to familiarize and make it more normal. And then this type of coping play can really help you assess your child's natural coping. So you could ask your child, how would they comfort their teddy bear? What would you say to make your teddy bear feel more comfortable and make them feel better? And as you can see, medical play has a number of useful applications like debriefing, coping, and understanding diagnosis. Now let's expand a little bit on supports for effective coping. So effectively coping with the uncertainty, isolation, and loss of control associated with hospitalization and disability is essential to improving a child's experience. One of the key pieces of effective coping is to establish a sense of control. Try to cover choices whenever feasible, even if it's as simple as saying, should the doctor look at your arms or your legs first? But however, be sure to only offer available and appropriate choices. Try to avoid saying, is it okay if they take your cast off? Because while it's polite to do that, it's very confusing for the child when ultimately they're going to have the cast off. You gave that choice and then you took it away. So really try to avoid doing that.
I have a question about that one.
Yeah, sure.
So I've been in a lot of situations where the medical professionals will say, can I get your cast off?
Yeah.
So, and I tried visiting the nurses and other other medical practice, whatever, please don't offer the choice if there is no choice.
I agree.
What else should I say to them other than?
I agree with you. Yeah. I work in a general pediatric office and I see the nurses and my other co-doctors every single day do it. And I think it's natural. We want to be polite and we want to just be like proper, but understanding how children learn and develop, this is the wrong thing to do. So I know it's exhausting, but
I know it takes a system like being compliant, and so I usually say yes, take your cast off for that medical professional. So it's just their way of trying to be polite.
It's a polite, I think it's just us being naturally polite, but it's incorrect. We should not be doing that. We should be saying, can we listen to your heart first and then take off your cast? That's okay. But we can't say, can the cast come off if it has to come off. It's just not appropriate. So I'm trying, at least in my tiny office, to get that to change. I think it's going to take a lot for the whole medical field to change. But it's very much, if you know about child development, it's not appropriate to do that. Yeah, no problem. Sorry, Lawrence. Okay. Validation, similarly, is another key component of effective coping. So you want to avoid minimizing the child's experience. You want to avoid saying things like, you're fine, it's just tape, it's just going to be a minute. Allow the child to be upset. Instead, focus on techniques that will support them through the procedure. And avoid saying, I'm sorry, over and over again. Because again, kids are so concrete. They might think that the medical staff is making a mistake, or they're making a mistake. Instead, try to say, they really don't mean to hurt you. They're trying to help you. So sensory and behavioral type of coping, there's so many. So I'll just mention a couple. Some can be sitting on a caregiver's lap, soft massages, sing-along, blowing bubbles. Then we have a lot of cognitive types. So, some of these can include storytelling, where a character in a story overcomes an accomplishment, such as the little engine that could. And then during the procedure, this is my favorite, where the child will play practical jokes on the staff during the event, or just tell silly jokes to the staff during the event. And this really just adds some comedic relief to a very tense situation. So this is one of my favorites. And then, kind of lastly on this topic, proper rehearsal is really vital to your chance of a successful procedure. So as some general tips, you really want to rehearse before the big event. You want to practice for complications, like what to do if the child can't stay still, and you want to demonstrate with medical play again, like, hey, this is your teddy bear. They're going to get their cast off today. What would you tell them to help them feel better? That kind of thing can be really, really helpful.
So, we've learned how to reduce anxiety for patients, the number of preparation techniques, medical play, and coping. I'm going to talk briefly on alternative focus and how to differentiate between distractions. So, the difference between distraction and alternative focus is truth and control. In general, whenever we have experienced any kind of trauma, the thing that happens in your stress event is a loss of control. So you want to be able to give back control to that individual. And when you're using distraction, it's when another person other than the child chooses to focus while the event unfolds, so it's the behind the child back. Alternative focus is important because it allows the child to work with their team to choose what life might best cause them to kind of focus on something else other than what's going on. Some examples that I kind of have of alternative focus can include using a visual focus, such as a glitter wand or a kaleidoscope, which I think are really cool personally. Or using humor, so what Courtney was saying, whether that's a telling joke or just talk about something that you might find humorous. Or we all know kids nowadays love video games. So a lot of them play video games maybe while the teacher or the teacher is going on so that they have something else to focus on while they're listening to whatever's going on back then for them. As well as that's like helpful.
A big thank you again to my nephew Liam for demonstrating that virtual reality set for me. As you can see, alternate focus is a useful tool in reducing pain and discomfort and improving coping. There's actually been some really fascinating studies, or maybe just fascinating for me, but that have shown a reduction in perceived pain through these specific techniques. Now let's move forward and refocus our own attention on addressing the needs of the family unit. As most of you are intricately and unfortunately aware, hospitalization and disability not only impact the family as a unit, but everybody involved. Some examples can include demanding care needs, interruptions in family plans and work, and lack of attention for siblings. Furthermore, caretakers can experience burnout, financial stress, even stages of grief. And likewise, siblings may harbor feelings of jealousy, stress, and anxiety about their own health. That being said, there are many ways that child life specialists and other team members can and should be supporting families. The hospital team should provide families with guilt-free breaks, preparation for big events, involvement in siblings, and connections to support groups. It is completely reasonable for you as the caregiver to advocate for these accommodations and support while your child is hospitalized. We recommend requesting a child life specialist early on, and if resources are available in your town, to choose a large children's hospital. Child life specialists can support siblings through things like coping boxes with journals and stress balls. They can connect them to other siblings to help support them, and they can assess the sibling's perspective of the patient's diagnosis through medical play, illustrations, arts, crafts, and discussions. Furthermore, child life specialists and caregivers alike can prepare the sibling for visitation with the patient through the use of storybooks, pictures, and videos. They can prepare them for how their sibling might appear different. Maybe they'll have lines in, a new cast, their limbs might look different. They can prepare them for being a little more gentle or what to say. And they can provide them with ways to stay connected. So in this day and age, video chat is great. But also I love the traditional letter book. It's just a blank journal that the siblings pass back and forth where they write letters, draw pictures, put stickers. It's really fun. And then there's these things called the invisible heartstrings, where each sibling is given a toy heart, and there's a theoretical string that's between them while they're apart.
So, I'm going to discuss the challenges and supports that are specific to children that have chronic illness, such as AMC. So, I'm going to begin by describing the significant structures that children with chronic illness might have. I'm going to kind of talk about how to support them through promoting development, as well as facilitate adaptation and different support groups and normalization. And we're going to finish all of this up by kind of giving you a case presentation and applying it to the case studies. So I'm going to start by identifying the challenges that are unique for a child with chronic condition. So as you can imagine, children with chronic medical conditions spend a lot of time in a medical setting. This frequent and lengthy stays in hospitals are accompanied by tremendous stress and barriers to normal development. Some of these might be a lot of times when a child is in a hospital setting, they're having more contact with adults rather than peers their own age, which a lot of times in peers can be very much harder for our age because of hanging out with a lot of adults. But we also do because that's important too. Also, content uncertainty. A lot of times in a hospital setting, we don't have that. We don't know what the next thing's going to be. We don't know when the next day we're going to wake up and see it. So there's a lot of like what if that happens, as well as loss of independence, whether that be physically or sometimes even mentally because of that loss that our own thoughts have. So I kind of talked about this. I'm going to go into depth about how to support them through developmental tasks.
So given that children with chronic conditions are at risk of developmental challenges, it's really important to provide activities to help support them. So normal developmental tasks can include mastery, competency, autonomy, peer relationships, and body image. I could reveal my very nerdy self and talk about this for hours, but for the sake of time, I'll give just a couple examples. So mastery is successfully accomplishing a scholastic, physical, or creative task. These can include just participating in regular household chores or administration in their own care, like giving themselves insulin if they're a diabetic patient, or for an AMCer, helping get their leg braces on. The next is autonomy. So this is a sense of freedom and independence, and we can help promote this by advocating for privacy for the patient whenever possible, and for participation in decision-making regarding their medical treatments whenever appropriate. Another example is peer relationships. Children with chronic conditions often have reduced contact with reduced contact with other children and more with adults. We should really increase opportunities for these children to have more peer contact to develop social skills. Child-like specialists are really good at helping the children identify skills that they're good at and helping them develop these social skills. And when they connect with other kids who have chronic illness, it really allows for the connection of a secondary support group, a lot like what we do here at AMC conference. So now that we've discussed ways to promote developmental tasks, look how we can also address facilitating adaptation.
So a lot of individuals that have chronic conditions, like medical conditions, have to be able to adapt to their surroundings. So with AMCers, we're very good at adapting to what's going on around us, and this is because of our chronic condition. In order to aid this process, we provide opportunities for self-expression and for play. Self-expression is often achieved through play, and through creative activities. This will allow the children or adults to recognize and express feelings and to be able to identify different coping skills that might be beneficial to them, because we're all individuals, and one thing that might work for one person might not work for another person. Some examples can include writing a letter to their illness, or the child life specialist can help the child create their own feeling story as to how a procedure might have them feel. The child can also participate in play, and play should be adapted to meet the needs of the individual child. Materials and environment should allow for independence and reinforce the other therapies, such as physical therapy and occupational therapy. Children with disabilities should be integrated with able-bodied and healthy children, and caregivers should be included in the treatment process so that the caregiver can also support the child, because like I said, caregivers are the number one support system that a child needs.
Preparation and education is also essential to helping children adapt to their circumstances. Preparing for a hospital course and education about their illness can help increase a sense of predictability. When you're providing education, you want to first start with assessing the base knowledge that the child has, and then when you start teaching, you want to use really concrete tools, repetition, and ideally an interactive approach. Again, proper language is crucial. Really try to avoid things like good or bad so, good or bad number, try to say sick, healthy, high, low, to really avoid shame and guilt. And then after discussion, when you want to assess understanding or comprehension, I find it beneficial to say, what would you tell your best friend? Or what would you tell your sister? Rather than saying, can you just repeat back to me what we talked about? I think it's just a lot more beneficial.
So effective coping is an important element to adaptation. Health specialists can play a really big role in this within the hospital setting. It is crucial that patients understand the rationale to their therapy, whether that be you as a caregiver explaining it to them, or have their physical therapist or occupational therapist explain that to them. Otherwise, they might feel like this is just another thing someone is forcing me to do. I'm that person because I really thought that. So it's really important to just explain why it's happening, but it's also important to allow the child to have a say in their treatment process and in their physical therapist. With the physical therapist and occupational therapist. As we discussed earlier, the key to effective coping is reestablishing that control. So an example of a way to provide control when in a hospital setting is to allow the child to maybe have 3 cocaine, 3 popsicle sticks, 3 of something to allow when a child needs a break, they can turn in that token and then doctor will take a break so that they're able to take the break when needed as a child, but also the process can get done.
I love this technique. It's so simple. I do it in my office all the time. I give those like the tongue depressors. I give them 3, and they can say they can just hold them up when they're done, and they get a break before we continue. So it's just something that's so easy, and you can really use anything laying around. It's really great. So the next element of adaptation is problem solving and goal setting. When establishing goals, you really want to create realistic goals with actionable plans. You want to focus goals on moving forward despite disability and illness. A great example that I have that my parents did, so when I had a cast on all summer, I've been so excited to swim, but I wasn't going to be able to swim that much with my friends. So we sat down and we made a list of other activities that I could do that summer with my friends, and we checked it off on the refrigerator throughout the summer. So it gave me an opportunity to have some control, some predictability, and to still have fun and move forward despite this part of my disability. The other aspect is problem solving, which I feel is the most important skill for kids with disabilities. Successful problem solving can be particularly empowering to these children who are often cast into situations that just require these skills. So really try to avoid as much as you can solving problems for the child, but rather encourage them to identify problems and promote independent thought.
through this because we have 5 minutes left. So I'm gonna skip ahead because I have some provide an example of an exam here. So I'm just gonna have that example that we're gonna take this how it's kind of try to do that. So this example that I have here is an 8-year-old female with ANC and along with I want to see the different structures that the child might encounter. So the pure example support is mother and father, shows a 6-year-old baby, which I said is a lovely little brother, and she has the support of the maternal grandmother. The upcoming medical structures that she will have in the fusion, and she'll remember the ICU for about 5 minutes. She'll be entering the school, and she will experience an IV surgeon and post-procedure pain, and she'll need to wear a glass ring, as well as will have significant swelling.
Through assessment, we found that our patient had a lot of anxiety about pre-procedural COVID testing, IV insertion. She struggled to understand why she needed surgery, what other kids might say about her brain, about her scarring afterwards, and she had no idea what the ICU was.
So some ways that interventions that could have helped her during the situation was allowing her to hold her hands during her COVID testing, allowing for the OR and the ICU because it allows her to know what the outside of the procedure was going to be, so she's not going with knowingly. As well as familiarizing her with the IV equipment, practicing with the numbing period, choosing her favorite music with advanced procedures because music makes everything better in my life. Choosing the color of the brain, making a brace for her teddy bear, and allows her to practice how she might answer those questions that her peers might have so that she doesn't go into it unknowingly.
For her sibling, they really struggled being apart, so the child life specialists were able to provide them with a letter book. On the calendar, they were given video chats, and they were both given the invisible heartstrings.
So as a learner, it was challenging for the child to experience with a long hospital days as well as missing school days. The interventions at the hospital was allowing her to calorie countdown for the long days and allowing her to kind of create a predictable routine. The calorie countdown is fun because it puts on these special events such as your brother coming in to visit you today, so the child has something to look forward to. And then having a hospital teacher so that the child doesn't get behind in school and it doesn't add another layer of stress to the child can have. And I kind of brought me an example. But I have here, this is a season of birds, which many hospitals have. There was a necklace thing, the one I have here is a caregiver. Being encouraged, so what happens is every being encouraged almost the same in the morning. But each time the child goes to the hospital, they'll get a different beat for the different things that they experience. Such as a black beat equals that they got a shot, or star equals they had surgery. And what happens is these beats are really outline their journey. So the child can see all the different things that they accomplished within the hospital stay, and they'll have to keep with them for their life if that's what they want to do. But it's just really beneficial to them to visually see what they've accomplished.
Yeah, the beats of courage are my absolute favorite piece. This concludes our presentation. Thank you so much for your patience with some of the slide things. It was a little challenging with the 2 different screens. So thank you for your patience. We recognize personally and empathize with the hardships that you and your children have gone through in medical instances. We hope that you learned something from this talk and ways to manage stress around medical treatment and feel at least a little bit more empowered in the future. Please feel free to stick around for questions. Before I open the floor, I just want to thank a couple people, child life specialist Samantha Hillary Alexandria, my husband who has heard this talk about 1 million times, my niece and nephew, Liam and Isabel Haynes, Rhianna's parents, Matt, Amy, and the rest of her family, the rest of my family, Dr. Zangosi, Dr. D, and Rhianna's mentor, Drew Grant. Thank you so much.